And as mentioned earlier, pleased to say we're going to be talking to Maria Caulfield, the MP for Lewes. Thank you very much for taking the time to talk to us, Maria. Hopefully you're well this morning.
Yes, and it's a lovely morning this morning. The rain seems to have hopefully gone away for a little while.
Fingers crossed, because it's been really random the last few days, hasn't it, the weather?
Yeah, absolutely. Had pretty, around Barkham in the constituency, we've still got quite a bit of flooding from the last downpour.
I was thinking about the River Uck the other day. I was thinking, is that going to... I mean, I know there's always that risk of it, but it's bursting its banks. I thought, is this going to be really bad? Because I know years and years and years ago, I think it was in the 90s, I seen a photograph of Uckfield really badly flooded. And I thought, I hope we don't have that situation again.
Yeah, no, absolutely. So, yeah, we're keeping an eye on all the flood alerts at the moment.
I was just going to talk to you about a couple of things. I know you're a very busy lady with various tasks, projects and campaigns. Today I wanted to talk to you about GP access and planning. I know you've been pushing this as well. I know you're really dedicated to this. So are you all right to have a little bit of a chat on there about this?
Yeah, because it's a massive issue for constituents. So I get so many emails and phone calls, and when I'm out and about, people saying to me, how, that they are struggling to get through. And I've met with local GPs as well who are saying, the work is overwhelming at the moment because, people have put off going to the GP while lockdown was in place. And there's a bit of a tsunami at the moment with people needing to see their GPs.
Yeah, and I think some people probably feel uneasy, because of the pandemic. And I know we're sort of coming out of the pandemic, but it does make some people anxious, doesn't it? With the talk of COVID in the news and stuff like that. So I guess people are on edge and, they're trying to get through to their doctor and stuff like that.
Yeah, absolutely. And, numbers are still high, although thankfully the numbers in hospital and number of people dying from COVID are relatively low. And so, but, the rising numbers does make people nervous. But we're trying to say to people, if you have got any health symptoms and you need to see your GP, do that because, what we're also seeing is people who did put off going to see the GP during the pandemic, often need extra tests or need more treatment. So we're saying to people, do come forward and don't wait and put it off. If you need to be seen or need to talk to your GP or, need to have your tests done, don't hold back. Do come forward.
Absolutely. It's a good message to put out there because I know some people are probably not aware of that. Is there going to be a chance of maybe some surgeries having their phone systems upgraded? Because I know some people have said, they've phoned the surgery and they've been on hold for ages and ages and then they've been accidentally cut off or they've just given up. I know that's been a reported problem with some surgeries. Yeah,
so some people have said that they've tried to get through and they can't. And so the government are doing a number of things. Firstly, they are helping practices with some extra telephone support because very often there's only, 2 or 3 receptionists and on a Monday morning, 200 or 300 people waiting to get through to book an appointment. So the government is going to be helping GP practices with that so that for some phone calls that could be filtered through if they're looking for test results or repeat prescriptions and that sort of thing, and just give them some extra capacity because they are literally overwhelmed with calls at certain times of the day. And then by the time you get through, your appointment slot that you wanted has gone. So I share the frustration and we're going to try and support GPs to increase their capacity. But also in terms of getting more appointments available, there's a £250 million fund so that if GPs want to, access locum services, extend their opening times, get in extra staff, maybe additional nurses or phlebotomists or whatever they need, there is funding there for them to be able to access that money to increase the services to try and open up. And one of the things that has happened is they have been under more significant infection control measures, which you would expect due to COVID, and some of those have now been lifted. So some GP practices physically with restrictions couldn't get people into their surgeries or could only get a few people in at a time. That's now lifting. So people should start to feel that they're able to get through a bit easier and get appointments a bit easier. And we're trying to support GPs in what they need to make that happen.
I mean, are we looking at more face-to-face appointments again then, sort of like the way it was before the COVID situation?
Yeah, it's about giving people choice. And some people have actually really enjoyed being able to speak to their GP on the phone, particularly if they're working, rather than, taking time off, going to the practice, and sitting in a waiting room with people who've got coughs and colds and that sort of thing. So some people have really enjoyed the new way of working, but others really want to be seen by their GP. So it has to be about choice. And that's what we're trying to open up. And there will be more face-to-face appointments. We are seeing face-to-face appointments already starting to increase. And the feedback from people is really helpful. So if you are struggling to get through to your practice, if your GP is not coping in terms of they can't get the staff, or they're overwhelmed with people needing to see them, then feed it through to your local MP, myself or Nuz or Caroline Ansell or Hugh. And that really does help us to kind of then feed into the NHS more generally to say, we're needing extra support here.
I know you have been working really busy. You've been tirelessly working on some of these issues. We're looking at more urgent same-day care for people that are, maybe quite seriously ill. Would that be on the cards also?
Yeah, absolutely. Coming out of the pandemic is, it's been a difficult time for everyone. And, the resources have all been directed at COVID. And while there's a push at the moment from some to go back to restrictions, we know that if you impose restrictions, it has consequences elsewhere. And so that's why if we can keep hospital numbers low and deaths remain low, we're really keen, because there's other healthcare problems that are equally important, and we need to support people going through those. So my plea really is for people, if you're due your booster after 6 months after your second jab, please go for it, because it's having an amazing effect in keeping people safe. And if we can keep the numbers low, that it means people with cancer, heart disease, whatever, will be able to get their treatment for those conditions as well.
I mean, I'm more reassured speaking to you, what you've just said. I mean, something else that's slightly off the subject that we're on, could we have more improved air conditioning in doctors' surgeries to keep, because we've got people sitting in the waiting rooms with coughs and stuff like that, maybe some people who might have COVID and might not realise it. Could we have an improved air conditioning in surgeries to keep the...
Yeah, no, absolutely. Yeah, and that's the £250 million, that's the sort of thing that doctors can use that money for. So if it means that they can put in better ventilation, and it means that they can get more people physically in the surgery, but in a safe way, then that's what that money is for. Because some GPs are operating still out of traditional houses, and they're not ideal for medical facilities. They're, old Victorian windows, or the windows don't open, or, they need replacing. So, there aren't, all singing and dancing, a brand new medical centres there. So those GPs that are struggling with that sort of thing, that money can be used for that. And it means that they can open up their practice in a safer way, both for them and their staff, but also for the patients as well.
I can relate to that, because the doctor's surgery that I used to be part of was literally a house converted into a doctor's surgery. And I guess with the way this virus moves through the air, buildings might need to be slightly different, and the windows and stuff positioned differently. I'm not sure on that. I guess that's what the scientists know about. But I know we have to sort of change our way of practice a little bit, don't we, because of this virus?
Yeah, and that's been some of the restrictions that have stopped GPs being able to get more people into their waiting rooms. If you've got a brand new surgery with air conditioning, they tend to be bigger, and the airflow's better, so they can have more people in. If you're in a smaller practice, you can maybe have 1 or 2 patients in. And so people think that the GP surgery is closed. It's not. But for the safety of everyone, they can't have the volume of people. That will change, because some of the guidance has now been relaxed. But also we want to help support GPs that if they need some improvements to the physical practice itself, then, that we'll support them with that.
That's brilliant. I think you've covered absolutely everything and much more. Thank you for taking the time to talk to us. Is there anything you want to add before we pop into another song?
No, it's just really to encourage people to get their boosters. They can book online. You don't have to wait for a letter or a text. If it's 6 months since your second jab, then please do book online or call 119 to get your booster dose.
Thank you, Maria Caulfield, the MP for Lewis. Nice talking to you.
Thank you.
Take care. Bye.
Thank you.
Take care. Bye.